This has been a conversation that I've honestly been looking forward to ever since we first scheduled. Even today, I was looking at my schedule and I was really fascinated by how much I was looking forward to the conversation, mainly because I have no clue what we're going to talk about. And I just think it's absolutely incredible. I think those are sometimes the greatest conversations is when you don't have the set of topics, you don't have the set of questions. But for anybody that is unfamiliar with who I have on today, I have with me Dr. Lauren DeCicco. And so, Dr. Lauren, I want to thank you for your time and for your willingness to have the conversation with me.
Yes, thank you. I'm really excited to be here.
I am excited to have you on. And for anybody that is unfamiliar with you, for anybody that is unfamiliar with your work and what you do, you are a doctor, but it has DPT on your page. So I'm going to let you explain that. I know what it is, I can explain it. But for anybody that is unfamiliar with Dr. Lauren DeCicco, DPT, what does that DPT actually stand for?
So, DPT clinically is a doctor of physical therapy.
Okay. I wanted to make sure that we understood that because when I had the conversation with you the very first time, I had no clue what it meant. And I literally had to go into ChatGPT and plug it in. And then I said, oh, it's a doctor of physical therapy. So one of the questions that I can't help but ask, and I'm going to get into what else is in your bio, but one of the questions that I can't help but ask is what was it that actually made you, when you thought of all the different professions that you could possibly do, you decided, I am going to become a doctor of physical therapy?
Well, I had a very interesting decision to make because I was either going to do graphic design or I was going to go into athletic training or physical therapy. So, completely opposite ends of the spectrum. And it really had a lot to do with where I ended up playing volleyball for college. And the school that I ended up choosing didn't even have arts in any of their programming, but they did have physical therapy and they had this amazing dual admissions program. So as a freshman, you could actually apply and become a part of the graduate program as a freshman and have your spot held and kind of transition very easily into the program. So it was in a way kind of chosen for me, but because I played volleyball, I had my own personal experiences with physical therapy, lots of different injuries and things like that. And I just loved being able to be connected with your client or your patient and going through the healing process with them. So I really do think that I was meant to be a physical therapist. I look back and I'm so happy that that was actually what I ended up choosing. And the other really amazing part about physical therapy is you can take that clinical degree and really become creative with it because you have so much knowledge and background of the human body and how it functions and how it works and all the different systems and all of the different areas of medical recovery from acute care to inpatient to outpatient to pediatrics and pulmonary and things like that. They teach you in such a well-versed way that those tools have allowed me to basically create and establish the way I practice now. So I'm very, very happy that I chose that background. And that's what I've done now with my practices. I've blended my clinical physical therapy background with a more holistic approach and started integrating also nervous system work and nervous system regulation.
What's fascinating about it is physical therapy is something that I am not entirely familiar with. I have a general understanding, but my understanding of physical therapy has always been what I've seen on TV or what I've seen in the movies. I have never personally experienced or needed physical therapy. So, for the average person that perhaps does not have an understanding of physical therapy, what it is or why it's needed, can you explain for me exactly what is physical therapy and why would it be needed in someone's life?
So, okay. So there's a lot of different applications of physical therapy. Like I said, it could be you're hospitalized and they might order physical therapy for you in that scenario, in that spectrum of your healing. We're really trying to, when the patient's trying to be more stabilized, we're really trying to get your basic function back. Like, get you out of bed, get you upright, help you walk if you can't walk. But our goal is to make you as functional and safe as possible through different strength movements or range of motion movements, or teaching you how to transition or transfer yourself so that you can be as safe and independent in your function as possible. So that safety and independence and highest level of function applies across the entire spectrum. So if you're hospitalized, we're trying to achieve your highest level of function. Or if you're on the opposite end of the spectrum of trying to fine tune your performance, for example, if you're a super elite high level athlete, we're still trying to achieve your optimal function with things like making sure you're pain free, you have the best range of motion, the best mobility, and the best motor control and coordination and balance to control that mobility and recover from an injury, but also optimize your performance. So the main concept of physical therapy is anything that could be hindering you from your highest level of function, your mobility, your walking, your running, whatever mobility you require to perform a sport, an exercise, your daily function. We want to make sure that it is not impaired or limited in any sort of way so that you can also live with a good quality of life. So, and that's different for everybody. We see people
Mhm.
that maybe are suffering from a neurological disorder. We're still going to try to get their highest level of function, but it might not look the same as somebody who's an elite athlete. So it's
Mm.
really about finding, when you evaluate somebody, you're looking at what are their restrictions? What are the things that are creating limitations, functional limitations or impairments that could be affecting how they're performing their day-to-day function? And then we focus on those. So, in the movies, you see people, they're always have somebody with a walker and then somebody's in their scrubs and they're walking that person in the walker. And yeah, that's a reality, but it really takes away from the entire scope of what physical therapists can do for people. So people's minds are like, oh, yeah, I go to the physical therapy and I kick my leg out a few times and I pull the bands, and there's so much more to it. But I think the perspective is just like, we just do these simple exercises with people and then all of a sudden they get better. But there's a lot of detail that goes into it.
What are some misconceptions or misunderstandings that we have about physical therapy based on what you just said? Because here's what I think of. I'm a big Marvel fan. I love the Marvel Cinematic Universe, and in I believe it's one of the Iron Man movies or one of the Avenger movies, Rhodey, who plays the Iron Patriot, sustains an injury. And at the end of the movie, you see him with what almost looks like the Olympic crossbars that you would see someone, and you see him walking through and trying to get his function back. So
Oh,
that's
yeah.
the imagery that comes into my mind right off the bat when I listen to what you say. So when we're talking about physical therapy, what are some misconceptions that we have about it, either about its function or its effectiveness or how it's actually used to get someone to maybe their optimal performance or optimal peak performance?
Yeah, what you're referring to they're called parallel bars, and they're amazing for people who can't walk independently on their own. So I think that people see a picture like that and think that it's just such a basic, simple thing, and that there's not a lot that goes behind the decision of why I would put somebody in a parallel bar, or why would I have somebody do this simple knee exercise? Why would I have this like elite athlete do something so simple? But it's about breaking down their most basic function and then building the foundation back up. So if somebody was an elite athlete and they have an accident and now they can't walk anymore, or they need to retrain their walking, or maybe they're not allowed to put all of their weight on the leg that just had surgery, we have to scale them back to these really, really simple, basic, foundational, very kindergarten level activities in order to build it back up. We're not going to just take someone out of a wheelchair and then have them walk around the room and start running again. So things like what you would see that looks so basic are actually the building blocks into being able to get back to your performance. And I think people look at physical therapy as not very complex in the thought that goes behind how we prescribe exercise for a client or a patient, but they have to consider the fact that people come in with such complex histories of, maybe they're a 25-year-old who looks really fit, but they have a really complex diagnosis or a neurological disorder or something underlying of why we have to scale it back to something so simple before we progress them into something a little bit more challenging. So I just think that the perception of physical therapy is that we're super basic and we don't have we have I went to school for 7 years. I think that physical therapists know probably some of the most things about the musculoskeletal system, the nervous system, all these different systems and how they play a role in how you perform your function every single day. We might not know it in a way of how we're going to apply a pharmaceutical or something like that. But we also have to understand that too. If a patient comes in and they're on 10 different prescription drugs, I have to understand how those medications are interacting with their balance, their function, how much energy they have to output when they're in sessions with me, what their blood pressure is going to look like. So there's a lot of complex knowledge that goes behind how we decide what we're going to do with each individual patient.
One of the things that you just talked about is there's some people that come in where it's almost like they perhaps have to relearn or retrain their bodies to perform basic functions that they may have taken for granted. And for whatever reason, maybe they had a stroke or maybe they had an injury. All I can think of is because you played volleyball, I can think of Misty May Trainer or Carrie Walsh Jennings, who are two famous female volleyball players. I just had to Google it because I did not know who they were. So here's a question that I have to ask. Let's say Misty May Trainer comes in, or let's say Carrie Walsh Jennings comes in. These are women that have been elite athletes. They have spent years on the high school sands or indoor on the court. They maybe did it on the collegiate level, then they may have done it on the Olympic level. So it's safe to say that they may have formed an identity around their craft. They formed an identity around their skills. All of a sudden, they sustain an injury. Their injury now prevents them not only from performing the way that they did, but now it's impacting their normal day-to-day life. It's impacting their motor functions. It's impacting their ability to do things that they've been able to do for years. When we're talking about the concept of identity for someone like that, how much of this is also a person that may come in and there's an additional layer that is in their mind where now they have to acknowledge the fact that, okay, this is very real. Like I cannot do these functions anymore and I have to retrain myself. Because I would imagine there might be some people that come in and see you and they're incredibly frustrated and maybe they're disappointed because of what they've experienced.
Yeah, there's a huge psychological component to even just a basic injury. And that could be for anybody. Anybody where all of a sudden your function, especially, in those scenarios, those people are depending on their elite athleticism to pay their bills. So it's an identity. And you see that a lot with high-level athletes. Like they really do identify as that player or that athlete rather than I'm this individual who is performing these things to create an income. It's typically not separate, but you could see that in just an everyday person who was able to walk, run, get out of bed with no issues. And now all of a sudden they need two people to help them get out of bed because they had a stroke and they don't have function of their body anymore. And that psychologically there's depression, there's anger, there's so much to it. Even if you take someone who's been in a wheelchair and you get them to be able to stand, even just being able to stand for 5 to 10 minutes dramatically changes their psychological health because that change in stature is huge for people. So you definitely see and there's also a lot of, if you look at someone, for example, if somebody had ACL surgery in their knee, they now have a residual scar. And I'm the physical therapist and I'm going to go move and touch that site, that scar. It's not just a physical trauma to that area. There's an emotional trauma that goes with that as well. So having that background, like I work with a lot of trauma in my practice because I do a little bit different approach than a very typical traditional physical therapy. So I'm working with people that have a lot of complex chronic conditions, complex autoimmune pain. They have a lot of emotional trauma in their history as well. So I'm very trauma informed. So even changes in the structure of somebody's physical body and relationship to an injury is going to have an emotional and psychological component to that
Mm,
and a fear and protective mechanism around that. So it doesn't
mm,
even matter how elite you are, but yes, you definitely see identity attachment to anything where your physical performance is what has gained you attention or purpose or income and things like that. But anybody's going to have a psychological component to a change in their level of function.
mm. There's an author, he's a European author, and I recently became familiar with his work, but he wrote a massive book, and the book is called The Body Keeps Score. I don't know if you're familiar with it, but it's by Bezel van der Kolk. And one of the things that I have on my page is that trauma is not necessarily what happens to you on the external level, it's what happens inside of you. Trauma is that emotional response, trauma is that psychological response. Trauma is that mental response that you have to what happened externally, whether it's a stroke or whether it's an injury, whatever it may be, as you talked about, even let's say an autoimmune disease, anything that would restrict your mobility, anything that would restrict your ability to perform the basic functions. So, with that being said, a question that I can't help but wonder is where does the process begin? Does the process begin on the emotional level? Does the process begin on the mental level? Or does the process begin on the physical level when you're considering getting that person back to maybe where they were before?
The process of recovery from the
Yeah.
trauma, from the
Yeah.
physical or emotional trauma. Well, my approach, it's a cycle, right? So it's a two-way street between the brain and the body and the messaging system. And when a system, a nervous system has been completely overloaded and overwhelmed either from a physical or emotional trauma, that system is going to be stuck in a state of survival, essentially. So my approach is more bottom up through the body. I'm trying to help people feel safe through a felt sensation in their body. So I use different pathways from the body, basically to the brain. I also like
Yeah.
to teach people. There are things that we use that are direct extensions of brain tissue that help calm the nervous system and come out of survival. Even if it's just while they're in my office, we're just trying to come back to a foundational state and not a hyper activated state that's been triggered and completely overloaded and overwhelmed the nervous system. And so, yeah, my approach is more bottom up based, but say a trauma therapist approach might be more top down approach. So we're still trying to break the trauma loop somewhere. It's just where you're starting from. But I think both are completely necessary. And in my own personal history of working through and healing with trauma, it took a team. It wasn't just like, oh, I regulated my nervous system and now it was, I taught my nervous system how to be more flexible and resilient to stressors. So then I could work on my trauma with my trauma
Mm,
therapist because it was so stressful to work on your trauma. But because I built more resiliency in my physiology, I was able to process more of my trauma and work through more of my trauma. So
mm,
I think important for all of it to be addressed and included.
mm.
But yeah, I think for me as a physical therapist, addressing an injury, especially if you can see that there's emotional component to it, having the awareness of that nervous system and the survival states and helping your patient or client come back to a neutral zone as they start their physical therapy, you will have much better outcomes with what their healing process looks like.
What would you say is the major difference between your bottom up approach versus, let's say, a trauma therapist top down approach? And if there is either one or more differences between the two, do they ultimately both achieve the same objective? Do they both end up in the same place, even though you're beginning from a different place.
I would say, and also because that's not necessarily, I do nervous system work, but my scope is not mental health. Do I understand mental health? Am I trauma informed? Yes, but I will have clients that as we work through things in their body, emotions and things like that come up for them, or they become emotional and start processing those emotions with me. But I don't go into any of the mental health side of it, of
Hmm.
basically walking them through as if I were a therapist or a psychologist or anything like that. But I work with trauma therapists. And from a trauma therapist or a mental health therapist standpoint, sometimes they're going through top down processing, bringing it up, and they start seeing where the nervous system in the body starts to almost create resistance or become activated. And it depends on their training of whether or not they understand how to bring the body back into safety. And there's a lot of different tools that they're using now in therapy with trauma, like EMDR and ketamine
Hmm.
assisted therapy and things like that, which are basically trying to teach the brain that it's safe enough to go through and start bringing these stories up so that we can process them, or these events that have happened in our past that we can start to process them. So, I mean, I in my lane as far as a
Right.
professional, but
Right.
you can see where they do start to intersect of where my thoughts and the events that I need to process start pulling up stuff in my body. So you might need somebody who can physically understand how the body is storing and holding that in the nervous system to address that part, where I can see we're starting to bring up the storyline in their brain, and they're going to need to work with a trauma therapist or a mental health therapist to address that part of it too. So I love working with mental health therapists, especially when I can see something is going on in my client that might be holding them back from getting fully better in their chronic illness. I see it in chronic illness all the time. I see a lot of compulsion, like OCD type behaviors and things like that, really almost like obsessed with not being sick or wanting to be sick, but stuck in this loop, this story of I can't get better, or obsession over their symptoms, or I felt this today, or now I'm going to go see this doctor because they might have the answer. And of
Yeah.
course, it's all with good intention of like, I want to get better, but it's also keeping them hyper aware and hyper vigilant of their symptoms, which is driving more symptoms essentially. So patients like that, I think, do really well also getting therapy. So even if it's a physical thing that they're dealing with a physical ailment, I do think like the mental health component is really important for their care in getting better physically.
I'm sure you remember the show that I'm about to reference, but and I might be dating myself when I reference this show, but I grew up watching Baywatch. I grew up with David Hasselhoff and Carmen Electra and Pamela Anderson and watching them in the red bathing suits. And in one of the episodes, David Hasselhoff was performing a rescue, and it was near a cliff. And the wave, of course, and the riptide, whatever it was, it forced him into the cliff, and it actually temporarily paralyzed him where he couldn't experience any function in his lower extremities. So he couldn't experience any function in his legs, in his knees, his feet. He was just completely immobile. And I don't remember the episode in its entirety, but what I do remember is that in the episode towards the very end, there was a younger boy that was in danger, and there was a weapon that was on the edge of the pool. And David Hasselhoff's character, who previously could not do anything, actually kicked the weapon into the pool. And I remember the little boy sharing it. And the reason why I asked that, and the reason why I even bring that up in listening to you talk, I can't help but wonder if there's times when the body wants to respond. If you begin from the bottom up approach, the body wants to respond. The body can experience healing. The body is resilient, and I'm amazed at what our physical bodies can actually do. Have you experienced instances where you know that the body wants to respond? You know that the body is capable of doing it, but yet you've seen someone mentally, you've seen someone emotionally hinder themselves, because I would imagine in those types of situations, your approach might change or you might have to do things a little bit differently. Is that a safe assessment? Is that a fair statement to make?
Yeah, I definitely think that there's beliefs coming from, especially if somebody's been unable to do something or was able to do something and lost it, for example, and then they've been dealing with it for a long time and they feel like they can't get back to where they were. There starts to become a belief of, I can't do that. And then therefore you're not going to be able to do that, of course.
Mm.
But I look at it, and I think in my early days of physical therapy and in a lot of the medical system, patients who don't get better are often labeled that they don't want to get better. And so we would often look at these patients who are a little bit more difficult or challenging to treat because they wouldn't get better or perform well with traditional, like things that work for everybody else aren't working for that one particular patient. So we'd pin it on the patient. Like they don't want to get better, or they're self-sabotaging, or they're lazy, or they're not motivated, or they're, non-compliant. And what I've seen working for years now with patients with chronic conditions is they are desperate to get better, but sometimes they do have these stop buttons, but it's not coming from an unwillingness. It's coming from a fear, and it's also coming from truly their nervous system trying to protect them. So I stopped attaching it to the behavior, to like their personality, or like they just don't want it. I started attaching their behavior to nervous system states. So when you have been in chronic survival for a very, very long time, you actually shift into this portion of your nervous system where you start to become immobilized, but it's out of protection. So when you can remove that layer of emotion from how people are acting, you can see that a lot of it is because of the survival state of the nervous system. And when I would start addressing more of the nervous system and creating safety for them, all of a
Mm.
sudden their story and their mind is, oh, I can do this, or I will try, or that didn't hurt as bad, so I'll do more of that. So I could definitely see the actions, the outcomes of the actions are completely different based off of where they're at in their nervous system. And I think that's a huge missing component in the traditional medical model, is when we're looking at patients that aren't getting better with typical modalities that work for everybody else. We need to start addressing, where are they at in their nervous system? Are they self-protecting, or do they feel safe here? And then
Mm.
once we get them to safety, they can access things like motivation and pushing themselves a little bit harder, and they have more activation in their nervous system so that they can actually do the things that we're asking them to do that ultimately will work for them, but they're not going to work if somebody's stuck in survival. You can throw everything in the kitchen sink at it, and it's not going to work for that client if they are stuck and immobilized in their nervous system. But you could see how in that show he was immobilized essentially, but there was this like instinctual thing that overrode that he then was able to activate and respond to.
Yeah. Yeah. Don't ask me why that came into my mind while I'm listening to you talk, but I remember it very clearly. And so I'm like, you know what? I'm going to reference it. And so, how long
I
have
mean,
you
I think
been?
I'm your age. I think I'm probably close to your age or older, but I don't remember that particular Baywatch episode.
You know what's going to
But I love
happen?
it.
After we finish this, I'm gonna find the clip and I'm gonna send it to you. And whether it's on YouTube
Yeah.
or whatever it is, I will find it and send it to you. Don't ask me how or even why I remember it. I have no idea. I just remembered. It's amazing what our mind and our memories actually store. I continue to be fascinated. The more I have these conversations, the more I realize, where did that come from? I didn't even remember that that was stored. How long have you been practicing physical therapy?
17 years.
Okay. So I would imagine over the course of 17 years, you've had some crazy experiences. You've had some extreme cases. You could probably write a book about everything that you've experienced having practiced physical therapy. So what has been probably the most extreme case that you have seen, whether it's just on a physical level, whether it's on an emotional or mental level, or maybe a combination of all three of them?
I'm gonna have to think in my Rolodex here of crazy case. The most notable ones are definitely behavioral and person the wild things that have happened that you're just like, oh, just another day in the office. Like I could write a book because I can't believe
Yeah.
that this just happened with this this person or this client, I mean, especially in physical therapy, you are spending so much one-on-one time with patients, and most adult humans don't get to have those kinds of interactions with people at that level. So it's also, there's a lot of connection that happens because you're helping people in a very vulnerable position, and
Yeah.
you're working with them over so much time that you learn so much about people. And in the setting I'm in now, I'm one-on-one with everybody. I have amazing clients. Like, even my clients, sometimes I'm like, oh my God, they heal me based off of how
Mm,
they show up and like what we get to get out of our systems and talk about and things like that. So I have like wild things like that. But I mean, as far as a diagnosis or a case, I mean, what I will say now of what I've never seen before in practice is how many people are dealing with autoimmune conditions and long COVID symptoms and unresolved systemic system or syndromes and diagnoses, like, or they're not even, they can't even get diagnosed because they're not falling under a specific diagnosis, but they have all of these crazy symptoms going on in their entire system since COVID, essentially. So I've never seen anything like it. And obviously I specialize in that. So there are people that seek me out to do this, but especially males. I've never seen so many males that are coming in with chronic illness as I've been seeing now. But there was, COVID was, I think, a collective trauma to society. So I think the level of stress created this complete overwhelm and overload of the nervous system. I think the virus itself really overwhelmed a lot of people's systems and unlocked a lot of these inflammatory processes. And now people are just like, don't know how to resolve it because their whole system is on fire, their immune system, their inflammatory system, their nervous system. So I think that's kind of like a very interesting thing that I'm seeing across the board. And I think a lot of providers would probably say they're dealing with a lot of that coming in too.
yeah. What's interesting about the pandemic is I have long wondered what was the greater impact, the actual, we'll call it the virus itself, or the psychological or the mental or the emotional toll that it took on a lot of people. Because we have to remember that for months at the bottom of the screen, there was a ticker that provided all the different death tolls. And as someone myself who lost a parent during the height of the pandemic to COVID, I understand that. I understand it in probably a much different way than other people would, because I remember standing by my father's bed when he breathed his last. I remember when it hit me, hey, your father just became a COVID statistic, and all those numbers that you saw on the bottom of the screen, hey, yeah, now in the state of Virginia, your father is one of those. And it does something to you. It does something to you emotionally. It does something to you mentally. It does something to you psychologically. And I have had to work through that. I have had to process that. And because of it, I have found myself asking what has been the greater long term impact, because you referenced long COVID, but you also referenced the emotional, psychological, and mental toll. So in your profession and in what you're doing, because you're seeing all of this, and because you said that you've seen somewhat of a rise post pandemic, the question that I can't help but ask is what would you say is the greater impact, or what would you say is the greater source? Was it the actual, we'll just say, the virus itself, or would you say it was the psychological, the mental, the emotional toll that all of this had collectively that now made people maybe more susceptible to things?
I mean, I'm a strong believer that one of the biggest healers for people is being able to have connection. We've never been the same since COVID, just even
Agreed.
in our culture and communities. Like, everything's still virtual. Why? Because we found out it was really convenient and it saved a lot of money, but we are and I see people, like, especially in South Florida, there's been a huge amount of people starting to create community groups, and people are dying for it. They need it to, and we lost so much of that. And we are just on these little islands and separated from the people that fill your cup, essentially. And even the process that you went through with your dad, it's just, it's almost like you didn't even get to experience the real full process of it because of everything of the protocols and everything that happened, and you're still
Yeah.
left probably a little bit unresolved. And
Mm,
I really feel like there's still such a dent in how we live our lives that is still residual from COVID.
yeah.
And I do think that there's a lot of residual illness from it,
Mhm.
but I think that a lot of that coincides, and I think a lot of autoimmune and things like that coincide with emotion and stress as an underlying driver of it. So
Yeah.
I don't know. I think the longer term effects of what I've seen and like the bigger impact has been what it's done for us emotionally and
Yeah.
how we continue to live as if we're still like there's all these things that are still existing that shouldn't even be existing anymore because of it.
Yeah, I am amazed at how drastic the impact of that because it didn't just happen on a state level. It didn't just happen on a regional level. It didn't happen on a national level. It happened on a global level. It impacted the world. Like nations were effectively crippled and paralyzed, and governments were impacted by it. People's livelihoods were impacted by it. And I don't think a lot of people were able to recover from it. I don't think a lot of people, even now that we are, let's just say we're 4 years removed from it. Let's put the end of it back in 2022. So let's say we're 4 years removed from it. I'm amazed at how much people are still being impacted by it. Not even just those that have lost someone to it, but those that have are still reeling from the effects of what they saw, what they heard, what they witnessed. Because I don't know of anything in my lifetime that was as much in your face as that was. I'm really trying to remember and think back. The only other thing in my lifetime that I think was probably that impactful and that in your face was back in 2001 with the Twin Towers. Like, that might be the only other thing that I can think of that really had gained as much dominance and prevalence in people's minds and people's thoughts, and it impacted people's emotions. And it is absolutely incredible when I think about that because I had a conversation with a doctor of osteopathy, and it was an amazing conversation because he was a doctor of osteopathy in Australia, and the way that he described the mind and the body, and the way that he described how even our past experiences can be stored in our body and can open up our bodies to chronic inflammation and chronic illnesses. Hence the reason I go back to Basil van der Kolk's work, The Body Keeps Score, because I think even with something like that, your mind and your body are both storing all of this information. What stores the most?
Mhm.
I don't know. I don't know if your body stores more or if your mind stores more. I don't know if you have a thought on that, but I'm
I
amazed.
think that that's where like a lot of professionals out there are kind of arguing both sides of it. And I think it's both, like you're going to see changes. You can see
Yeah.
changes on brain MRIs and you can see changes in the fascia, in the posturing of the body. Like I can tell when somebody comes in where they've held everything in their body and where it probably
Mm.
started with them. And I can see exactly what their body does when they have a stress response based off of where they're holding all of their attention and how they posture themselves. So how it's translated first, is just I think that there's still like I think the fact that we're even recognizing that the mind and the body go together, which we've known since ancient times, but for some reason modern medicine wanted to dismiss that. I think now we're coming back like, yeah, oh, there's science that proves it. Like, yeah.
Yeah.
But
Yeah.
I just, 100% it's in both and it presents in both and it changes both. And it doesn't always have to be because of a trauma. It can be because I had this conversation last night with a group about, we talked about how trauma can change or anything, any sort of event that starts to overwhelm and overload and flood your system that it just doesn't have capacity for is going to start making lasting changes. And she was like, but I had such a great childhood. I had loving parents. I have a lovely marriage. I have a great life and whatever. I was like, I think if you are alive in society and this culture that we exist in, And we have such chronic load coming in, stimulus coming in, coming in, coming in. The phones, the swiping, the craziness and the chaos in the news, if you're exposing yourself to that, it's impossible for your system to carry that amount of stimulus and load. Even if it's not a direct trauma to you, it is your nervous system is starting to turn all of that into micro threats because it's like, I need a break. I
Mm,
need recovery somewhere. So even just like living in this, what we live in and the exposure of what we live in is enough to create this in your system.
mm.
But throwing trauma on top of it and,
Yeah, yeah.
you know,
Would you say that maybe one of the more practical tools in your arsenal or one of the more practical approaches is maybe what I would call detachment? You mentioned the news, you mentioned the cell phone, you mentioned all of these different things that can make you more susceptible, that can be triggers, that can impact your nervous system, that can impact your mental health, they can impact your inner peace, they can impact your emotional safety. And especially when you're dealing with somebody that's coming in that requires physical therapy, are there physical, let me rephrase that, are there practical approaches beyond what you offer, such as turn the news off, spend less time
mhm.
on your phone? Are there other things that that actually help contribute to people's recovery rather than just, let's say, what you have to offer?
Yeah, well, when I start with people, especially for, I mean, everybody I work with, I'm integrating nervous system work with. So if you're coming in and you just sprained your ankle last week, we're still going to try to make sure that your nervous system is shifting from protective survival back into safety, essentially, so that we can control the inflammatory process, the tissue tension, and things like that. But if I'm specifically working with somebody who's coming in for more nervous system specific work, maybe they're chronic illness, chronically overloaded, maybe they have personal history of trauma and their nervous system is on fire. At home, their assignments are essentially clear your plate. We need to offload your nervous system as much as possible. So you're not watching any shows that have crime, trauma, anything like activation. You're not exposing yourself to the news.
Mm,
And it's not to be ignorant or uninformed. It's that your nervous system cannot handle what it's being exposed to that extreme at this point in time, in the beginning, until we can get your nervous system to basically come back to a neutral baseline. And then we can start putting stress exposure back in because it will have more capacity to handle it. But these people are think about a bucket of water and that bucket is just spilling over because they don't have any space to handle anything else in that bucket. So we need to create space somewhere. So we can do that by monitoring what kind of people or environments are we in or around. Are there people in our lives that we don't have to have interactions or exposure to that are, you can tell, are adding stress to your system? So
yeah.
if it's doesn't feel good to be around or like it's filling your cup and warm to your soul, I say get rid of it if you can. Get rid of it. Clear your schedule of things that are not necessary, or obviously if you have to go to work and you don't like your job, like you still have to go to work and make money, but
Right.
you can start anywhere you can remove from your vortex of exposure of stressors that are adding load to your nervous system. We're getting rid of it. High intensity exercise we're getting rid of in that early phase. And like, yeah, you said like scrolling on your phone. I'd really like people not to be giving themselves that stimulus over and over and over again. So yeah, there's a lot of things that we can just start creating space for our nervous system by just removing it and detaching from it if we can, and it's reasonable and it's not necessary for our day-to-day, like making a living. And like, yeah, your children are probably really dysregulating and stressful to your nervous system, but you still have to be a parent. But so yeah,
Right.
wherever you can, detaching, yes, you 100%. And that is like obviously free and easy to do.
Right.
Yeah. So, and like I said, once you have a little bit better flexibility in your physiology to handle stress, the real life is it's okay to have stress in your life. But if you're getting to that point where you don't have anything left in your nervous system and you're getting sick because of it, you have to take it out of your life temporarily.
You used a word earlier that has, I think, become a buzzword. especially regardless of what type of relationship you want to attach it to. You use the word safety. And obviously, safety touches so many different areas: physical safety, emotional safety, mental safety, psychological safety, spiritual safety, all of these different components of safety that we would like to experience. Because you used that word, one of the things that I can't help but wonder, can you tell from someone's physical body, from when they come into you and they're clearly coming because they need help from the physical side? Can you tell when someone is safe or when someone is not safe because of what you see or what you may feel in their body? And you can automatically recognize this person either is not safe right now or this person hasn't been in safety for a while.
Yeah, and I think what you're referring to is their perception of their environment feeling safe or not to them. So activating
Yeah.
that protective response, essentially, of survival response in their system. Yeah, I mean, I can tell when I talk on the phone to people what state of the nervous system they're in. If they're in to like survival activation, or if they're in that protective response of being immobilized and shut down, I can tell by the tone of their voice, their eye contact, their posturing, their tissue tension. If they're sitting and fidgeting in their chair, if they're slumped down and their voice is very low and they're not really looking up or engaging, they're not safe. They're not feeling safe. Safety in somebody's body and their nervous system is shifted forward, engaged, open, posturing. Their tone of
Mhm.
voice is a little bit different. Their pace of their voice is different. I mean, I'll have people, they'll come in and they're definitely not in safety. They're in threat mode. And within maybe 10, 15 minutes of working with them, between my nervous system, which is in a safe place and regulated, they're going to start co-regulating. Their nervous system is going to start speaking to my nervous system and feeling my nervous system. So that co-regulation plus doing some different modalities that create safety in the nervous system, signal safety to the nervous system, they will start to drop into safety. And then they start laughing with me. They start telling me stories and joking and things like that. They'll go from not talking at all, maybe a little cranky even,
Right.
to perked up and
Yeah.
laughing and talking. And so you could see that shift immediately in people. And
I want
I'm
to,
hoping that's what you mean by when you're asking about
yeah.
safety with them. But
Yeah. Yeah, it is. So let me ask you a question. I want to do a real life exercise as best as you can because we're not in an office. We're not in a medical setting. Of course, we're talking through my cell phone, your computer. So in the course of this conversation, and because you can tell with somebody that's over the phone, you can kind of get a gauge on their nervous system. We're going to do a practice right now. So what is your assessment of mine? What is your assessment of let's say my safety, my nervous system? What is your sense?
well, and you and we've spoken before, and I would say maybe from, because we're recording today, so maybe you're a little bit more activated, but I just based off of the speed of your voice, and we spoke before
We did.
without recording. So I can kind of contrast a little bit,
Right.
but you're really familiar with this, and you're you're somebody who's comfortable with doing this type of work and you're excited about it. So I think you have like a healthy activation of your nervous system, but not to the point where you're hyper activated and it's making you like almost nervous, panicky,
Right.
but more excited. And that's healthy, right? So we're never saying that a nervous system shouldn't be activated. We just don't want it hyperactivated or not accurate to what the activity demands, essentially.
Mm,
So yeah, I would say that the way I'm reading you would be more activated, but excited, but safe, because
mm,
this is something that you enjoy doing and it's familiar to you and whatever. Now, that can shift moment to moment. Something could happen in the moment where all of a sudden something unexpected on your end happens and it sets you into like, oh no, panic. Like, what do I do? So it can abruptly change. And I have
yep.
people, like I said, they'll change in the moment based off of the input that I'm giving them, but they could change. A patient could come in really regulated one day and the next day the next time I see them, something happened in their relationship or their
Yeah.
symptoms, and they're just like a mess for 2 weeks, and then we get them back. Everybody's shifting and changing, and we're very dynamic and fluid. But But yeah, I would say you give off because you're warm, you're responsive, you're obviously looking into the camera. I know sometimes people are like, I tend to look because when I think about what I'm saying, I look
Hmm.
in directions because I'm thinking, looking for my thoughts and things like that.
Yep.
But I think those
Yeah.
are normal reactions. It's usually
Yeah.
people that are like, won't look at you at all and kind of look down like this, or and with the posturing kind of like
Right.
forward like that. But yeah,
Yeah.
what do you think? How do you feel?
Well, see, I agree with you on that. Like, because I'm more comfortable with this. I think when I first started this, I was probably, you know, you wouldn't have said that if you had talked to me a year ago. You would have had a completely different read on me. But because I am comfortable, because this is familiar, because I'm curious, because I've had so many conversations, I've had to practice talking to complete strangers. I've had to practice carrying on conversations. I've had to practice being safe for the person that's on the other side of the camera talking to me because they don't know me from a hole in the wall. And yeah, and some of them come with stories that are incredibly traumatic and having to manage all of that because on my page, I have the story component where of course people have shared with me their own stories and their struggles and everything like that. But then I have the other component to my page, which is what I would call the educational piece. It's kind of where our conversation comes into play, where I'm presenting some of these different things. And so I agree with you. I feel calm, I feel relaxed, but it's interesting because that varies from person to person. I may have someone on the other
Hmm.
side of the camera and I may not feel comfortable. I may not feel relaxed. I may not necessarily feel safe with them. They may give off a vibe, and I have to present myself in a favorable manner. I have to present myself in a safe place so that way they continue to talk. Believe me, and I'm sure you know this as well, there's times when that's a challenge. There's times when you may want the conversation to end and you're like, how am I going to go for another 30 minutes with this person, especially now that we've hit record? Like, it's not always easy. And I could think of one conversation in particular where that was the case. And I'm just like, no, like, just not feeling it. So, but I've had to work very hard. And I think this is why I'm having these conversations. And I think this is why I love having conversations about the nervous system, whether you're talking about the sympathetic, you're talking about the parasympathetic. I have a post that I just posted on my page and I love talking about fight or flight. I love talking about fawn or freeze. I love I love talking about neuroscience and neural pathways and neuroplasticity and neurodivergent versus neurotypical. I love talking about all this. This is stuff that is absolutely fascinating, especially when you come to the concept of survival, because a lot of people have trained themselves to stay in a state of survival. A lot of people have trained themselves to remain in a place where I would call chronic victimhood. And as you mentioned earlier, there's a difference in the medical world versus acute and chronic. They're two totally different things. They mean two totally different things. When you're talking about chronic illness versus acute illness and chronic disease, chronic fatigue versus acute fatigue, all of these different things. And the interesting thing about it is you're no stranger to that. You're no stranger to survival. You have a post on your page that literally says that at one point in time, you were in survival mode. And one of the things that I can't help but wonder is you've spent so much time in physical therapy, 17 years as a doctor of physical therapy. So that's clearly something that you're passionate about, clearly something that you've enjoyed. But at some point in time, you maybe had a realization, maybe had an epiphany, or maybe it was just an underlying passion that was brought up inside of you where now you wanted to focus on the nervous system. And the interesting thing about that is your name on Instagram says Dr. Lauren DeCicco, DPT. And it has the fantastic line that everybody has. But then right after that, it says nervous system expert, which I think is an incredible expression, not just passionate about nervous system. You could have used a number of different words, but yet you chose to use the word expert. And so my question is, it's actually twofold. Number one, what got you so interested in the nervous system? Number one. But the other question, it's not meant to be a dig. It's not meant to be condescending. it's meant as more of a curiosity standpoint. What is it that makes you not just nervous system curious or nervous system novice, but actually nervous system expert?
Okay. Okay, I don't know which one I want to answer first. Okay, we'll go with expert. The amount of education that I pursued beyond my physical therapy in
Yeah.
order to understand my own presentation. Because
Yeah.
what I figured out with my survival mode was by accident.
Mm,
And it was by some sort of miracle that I was able to experience what it was like to not live in survival. And I can
yeah.
honestly thank COVID for that. And in trying to figure out how did that happen and what was the correlation or relationship of why that happened. So taking the dive down every rabbit hole I could and finding any course I could to take and the hours of continuing education in those last couple of years that I took to be able to understand the nervous system, even like you said, like the presentation of somebody as I talk to them on the phone or they walk through the door, and then what each individual needs to be able to come out of survival and stay in safety for as long as possible. So, and I think that was all out of understanding what the fact that I could grasp what it felt like to come out of survival and then seeing that as a huge missing link, especially in the
Yeah.
physical therapy world,
Right.
of why people were not getting better.
Yeah.
But yeah, I think just like the obsession of finding the answers and
Yep.
continuing to explore the answers is where I would go more towards expert
Mm,
than
yeah. Yep.
maybe definitely more than curious, that's for sure.
Yeah.
But yeah, even I think we talked about this before, as I started doing all of these courses, all of my symptoms were getting better along the way. And I was like, wow, like this is huge in how this transforms. It's not just like the emotional and psychological part of healing from survival and trauma,
Yeah.
but the physical, the changes that happen at a cellular level when your body is in survival versus in safety. I mean, the
Yeah.
cells literally will lock themselves down and armor themselves when they feel there is a threat in the system, a
Yep.
perceived threat.
Yeah.
So we can do everything right with diet and medication and treatment. But if we are in that lockdown, armored, protected mode, we are not going to heal the way that we need to heal.
I think expert was correctly used in your profile. The reason why I think it's appropriately used is because I just started a job in a hospital and I am not a doctor. I am not obviously a nurse. I'm not a nurse practitioner. I don't hold any of those titles. And even in starting this role, I am amazed at some of the things that I have had to go through training for and complete modules for that I never went to school for. I don't have a degree in anything healthcare related. And yet here I am now. I'm starting a career in a hospital. And the amount of things that I have learned so far, and it has been such a short period of time compared to someone like you, 17 years that you've been practicing physical therapy, the stories that you have, the experiences that you've had, and the continuing education, which I feel like that's what these conversations are for me, is like it's the ongoing education of Stephen. And I hope that when people come on and they have a conversation with me or when people go to my page, that is one of the components that they see is this is someone who desires to learn. This is someone that's curious because there's two pieces
Mhm.
to it. And this is one of the things that you said earlier, which I think was absolutely fascinating. You referenced that while you were helping people, you were also finding that they were healing you, that you yourself were becoming stronger. You yourself were able to progress in your own journey. And that's what these conversations are for me. These conversations are hopefully a window into the fact that, hey, I am healing while I'm talking, which is crazy when you think about it, that you can heal literally
Mm.
by talking to someone. The other person isn't necessarily healing you, but that connection, like you talked about earlier, that was missing during the pandemic. I think a lot of people, again, to your point, what you said earlier about now they are desperate for it, they are hungry for it. And I think people are starting to realize that now we were forced to do life on our own for so long. And even myself, I had trained myself in survival, maybe not my whole life, but I can absolutely say for the last year and a half, I had trained myself to remain in survival and remain in a state of fight or flight, to race for impact, to wait for the other shoe to drop. And I was having a conversation with someone last night and again today, because my platform is faith based. I had a conversation. What's the difference between what a believer would call discernment versus what we would call intuition? And I know what it's like to live based off of my intuition and it based on the experiences that I've had. And so I can appreciate someone like you. I can appreciate the work that you do, especially when you made a statement that while you were trying to heal someone else or while you were trying to help someone else heal, you yourself found healing. So here's probably maybe one final question as we wrap the conversation up. What has been the single greatest thing that you have found was healed in your own life
Through this work,
through everything?
the single greatest thing that I've healed.
Yeah.
Ooh. I was so detached from who I thought from myself, completely detached. I was living my entire life for everyone else
Hmm.
and purely out of safety, the
Yeah.
need for safety, the
Yep.
need to survive.
Hmm.
I didn't even, when I 2021, when this all massive, my life massively changed and I started realizing like this isn't right or good and things need to be different.
Yep.
The ability to come back to myself and really learn who I am, the essence, the core of who I am, and be 100% okay with that and not afraid of being punished for it or losing anything for it. I think that was, I mean, everything else that gets healed because of that. So, any
Hmm.
other category of healing, the way I've parented, the mother I can be to my children, who I can show up in my professional life is all at the core is you coming back and being whole with yourself and connected and essentially having trust and self-love and compassion for yourself.
I wholeheartedly stand behind everything you just said, and everything you said resonates with me because I have had to learn how to love myself. I've had to learn how to be kind to myself. I am in my early 40s and I am starting to understand who I am. I'm starting to understand my worth. That may be because, let's be honest, and I have no problem admitting this to any woman, men tend to mature at a much slower rate than women. It's a fact, and I have absolutely no problem saying that. Some men might get upset at me for saying that, but it's a fact. So I'm in my 40s, and I finally feel like I'm starting to step into who I've been created to be and who I've been put on this earth to be. And it has been one of the most rewarding experiences. And I am understanding the difference between making the blanket or concrete statement that I am healed versus I'm healing, because there's a difference. And I understand that while there may be parts of me that have been healed past tense, there are parts of me that are continuously being healed. And I am on a healing journey. And I recognize that, which I think is absolutely fascinating. And so hearing you talk about that is encouraging even for me. And I think your answer is fantastic. Now, with all of that being said, in these conversations, I have typically towards the end of the conversation, I've started introducing what I call a flip the script moment. A flip the script moment is essentially I've spent over an hour now asking questions, guiding the conversation as best as I could. But now I'm going to flip the script and I am going to put you in the driver's seat. Because you're no stranger to podcast, because you're no stranger, I'm going to give you the opportunity. If there's anything you've been curious about regarding me throughout the course of our conversation, if there's been a question you've been wanting to ask me or based on my page, I'll turn the floor over to you to have the freedom to ask.
Okay. What
It's fun. It's a fun exercise, right?
what is the biggest lesson you have learned about yourself since starting the podcast? Either something a guest has reflected back to you or
Mm,
And I kinda wanna know it in a way of, like, that you discovered as a personal, like, belief or wound that wasn't necessarily aligned with you coming into your authentic self. What has been exposed to you as one of your biggest lessons of things that you want to work on or heal?
Interestingly enough, and I totally just did the eye thing that you did, looking up, trying to find your thought, trying to
Mhm.
make
You're
sure that I
finding it.
answered. Yeah, I was looking for it as you asked the question. So the greatest realization actually didn't come in a recorded conversation. It came as a passenger in someone else's Jeep. And I don't even remember what the question was that I asked him, but he made a statement to me, knowing that I've been having these conversations, having watched several of the clips that I that are also on my Facebook. And he made the statement, and I will never forget it. And it has stuck with me ever since he said it. And that is, Steven, you're very good at hiding in plain sight. And when he said it, it hit me because I can have these conversations, I can talk to hundreds of people, and yet at the very core of who I am and what I'm doing, it's very easy to hide in plain sight. It's very easy for me to hide my flaws. It's very easy for me to hide my imperfections. It's very easy for me to hide my weaknesses, especially when everybody is not just craving connection, they're craving authenticity, they're craving genuineness, they're craving honesty. I have found that that has been one of the biggest things that I have had to confront inside of myself is, what am I hiding? What am I hiding from? What am I hiding or concealing? What am I unwilling to allow the spotlight to shine on? And that's why through these conversations, I've tried as hard as I can to be as vulnerable and authentic as I am. Are there more recent events that I've experienced that I'm not potentially in a position to share openly about? 110%. But these conversations are, in a way, an attempt to not only heal, not only to learn, not only to grow, but to allow a spotlight to be shined on me, because I consider this to be sort of a, some people journal and that's great. And some people blog and that's great. I am a verbal processor. I do my best work by talking and having these conversations. I am not able to hide anymore, which is why I have so many of them, because there's that additional component that, you know what, I have to live my life out in the open. I don't want to live in the shadows anymore. I don't want to live in what people might consider darkness. I don't want to hide. I want to make sure that the only way that I can describe it is, I was having a conversation with my buddy Lindsay in Australia. And one of the things that he said, he referred to it as cracking himself open. And so I am having to learn the art of cracking myself open. And what makes it even crazier is doing it with a complete stranger. Some people, to your point about safety, some people require that safety. Some people require knowing a person for years. Some people require that. Me, on the other hand, so much.
You're
I will
diving in.
I am diving in, and I am diving in with complete strangers, and I love it. It is one of the greatest joys that I have in my life, because to be able to have a conversation with a complete stranger and not only build rapport and respect and maybe a measure of trust where they can open up and have a conversation with me, but also where that can be done in reciprocity, where I can actually do the same thing. I can open up and I can share with them, even if we met for the first time 10 minutes before hitting the record. That has probably been the single greatest thing that I have learned, and I am still learning in this process.
I think that's so important that sometimes we take our greatest fear and we dive head in. And the fact that you are doing it repetitively and giving yourself almost exposure therapy on a repetitive level,
Yeah.
like now you have the component of that neuroplasticity and that rewiring and the thing like that. Like sometimes it's like taking the trigger, the scariest thing in our life, and facing it over and over and over again. That's
Mhm.
what creates a completely rewired experience with it and in the healing process. So
Mm.
that's amazing.
I think they say it takes 21 days to create or break a habit, and repetition, like you just said, is something of
Mhm.
the utmost importance, and all I could think of, the author's name is escaping me, but the name of the book doesn't, and it's called Atomic Habits. I look at what I'm doing right now as an atomic habit. I really, really do, because it is being repeated over and over and over and over again, hours upon hours. And I will fall on this sword and I will die on this hill, regardless of who wants to disagree with me on this. I will stand by it. I am convinced if you get yourself in the right community, you have the right conversations, and you ask the right questions, you can possibly bypass hours in a therapist's office and save yourself hundreds, if not thousands of dollars just by getting what we talked about earlier, connected. And that is what I'm doing right now.
Connection. Yep.
We
For sure.
heal through connection. We grow through connection. We evolve through connection. And that is why when someone comes on and has a conversation with me, my goal is not just to, thanks for the hour and a half recording. Thanks for the video that I can edit and put on my YouTube channel. Thanks for the 2 or 3 reels I'll put up on my page, tag you as a collaborator with, and then we never talk to each other again. And either I ghost you or you ghost me, and we'll still follow each other. That's the extent of where it's gonna go. Like, as a result of these conversations, I have people that I can text, call, FaceTime, DM at any point in time, and that has been invaluable, and it has been so enriching for my life, and it has helped me, and that's my hope that when people go to my page or when people listen to these conversations, that it inspires them to do the same thing, that they will then turn around and find that for themselves. So hopefully there's a level of success in that. I will not be the judge of the success. I'll let other people judge the success of that. But that is my hope, is that people recognize that, and that as a result of that, they then pursue it themselves.
No, you're building an awesome thing here. So I'm happy that you invited me and included me in it.
You know I was part of a church, and one of the things that the pastor always said is the first time you come, you're a guest. Every time thereafter, you're family. So when you're here on this platform, the first time you come, you're a guest. Every time after that, I consider you to be a friend. I consider you that whole familial aspect. So I'm grateful. I think that at some point there should be a part two. I don't even think we scratched the surface. We spent a lot of time talking about the physical therapy aspect. We touched on the nervous system throughout the course of the conversation, but I think that that's something I really want to dive into a little bit more, because I realize I'm talking to a nervous
Yeah.
system expert. So I think it's absolutely incredible. And I think it might be helpful even to learn more about you and some of the things that you've had to work through and some of the practices that have been beneficial for you. Because I'm sure to put something like expert on your profile, you don't put that on there simply based on knowledge. I think you put that on there based on experience as well. And something tells me, especially after reading your second post at the top of your page, you've been through some stuff. You've experienced some things in your life, and they have helped you to become the person you are today. And I am grateful for it. I'm grateful for your time. You could have ignored my message altogether. You could have said no. You could have said yes and then changed your mind and said, nope, not feeling it. But yet, even after our initial call, you decided that you wanted to actually hit the record button. So I have to thank you for your time and your willingness to have the conversation with me.
Yes. No, thank you. I love to keep an open mind. And I know after we had our conversation, I was like, no, this guy, I love how much you explore with your guests and don't just stick to a script and just see where it goes. And I agree. I think there's a lot to my story of why I do what I do. And I think that's important for clients to understand, the people that you work with, that like I just didn't read this in a book and try to tell you to go do something that I've never done myself. I
Yeah.
practice this
Yeah.
every day. I have
Yeah.
to live by this or I am not a functioning person. So
Yeah.
I 100% it has been life changing for me. And I appreciate any opportunity that I get from people reaching out to give me the chance to share it with anybody. So if it helps one person, then I've done my my duty for the day, and I'm happy with that, and, it's empowering information, it's life-changing, it's free.
Yeah.
Things that you can do for yourself that are free as long as you can open yourself up to that level of
Yeah.
exploration of the deep stuff that sits inside of you, then you can really be empowered with the tools to do this for yourself.
Well, Dr. Lauren, consider this a formal invitation for a part two. Consider this a formal invitation to come back on because I have a sneaking suspicion that there's so much more that you and I have yet to explore, and I'm excited to explore that with you.
Yes, definitely.
All right.